Folks, consider this a public warning. I've spoken about fillers before, mostly about their inefficiency, about lifting the face, as well as the potential consequences of looking unusual if you're using it over and over again over time. But this topic really is about danger of using fillers, especially if one day you're gonna consider having a surgical procedure like a facelift. And as a facial plastic surgeon, this is something I deal with on a daily basis. And I thought it'd be important to let you know this, let your friends know this, let your families know this, so that you can make wise decisions. This is gonna be about fillers, it's gonna be about threads, it's gonna be about Sculptra, and just kind of that general category of things that can make surgery more difficult. So you definitely wanna listen to this, because one day you will probably be on the table having a facelift. All right, let's get with it. Hi everyone, I'm Dr. Amir Karim, board certified facial plastic surgeon and founder and creator of Karim MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. We're gonna talk about the dangers imposed by fillers when it comes to having facelift surgery. This is something that I think is not talked about enough. I think it's something that is shared a lot among the facial plastic surgery community as we go to conferences and sit around a table and we're sharing stories about challenges. And this one comes up quite a bit. And it's something that I think you should know about, because at the end of the day, it's your face and you're gonna be incurring some level of risk and imposing that risk onto your surgeon because of the choices you make today. So let's put this all into perspective. Facelift surgeries are a challenging operation. It requires specialization, it requires board certification, it requires a certain level of commitment. As you know, in my practice, I do nothing but facelifts. In my practice, it's called a vertical restore. It's a completely unique and trademarked procedure. Nevertheless, it's in the category of a facelift. Nowadays, facelifts are being done more, I would say, aggressively, in a good way, and they're applying techniques that have been around for a long time but have always been limited to the most experienced or more or less committed surgeons. And those are techniques like the deep plane. So for example, the deep plane facelift you may have heard about is a technique that's actually included in my vertical restore, but it's a technique that I took about 10 years before I started to move into it. I had 10 years worth of using a slightly different technique, a much less invasive technique, a much more low-risk technique. And then I evolved after I felt like I had a certain level of surgical experience and skill, and evolved into the deep plane. Now, the deep plane has been around since the mid-'80s, believe it or not. And again, as I said, it was pockets of surgeons that had practices that were exclusively facial rejuvenation type practices, had a lot of experience. There were older surgeons, more adept to these, and they were doing deep planes for their patients. And as a result, they were getting some of the best results out there, the most long-lasting results, et cetera, et cetera, et cetera. So it was always viewed as kind of the elite technique, but it was also a large barrier to entry for surgeons to enter, meaning someone like myself getting out of residency and fellowship, I probably wasn't willing to take on that challenge or that risk, so I did a different technique. And the trends were more towards less invasive techniques, especially at that time. Now, the trend today, largely because of social media, when I go off and I put my before and afters out there, and other surgeons who do very nice and fine work put their before and afters, and they're using the deep plane, well, you as the potential patient see these awesome outcomes, see how beautiful they are and how powerful the rejuvenation is and how natural it looks, et cetera, and you want that for yourself. But the reality is there's a very small number of surgeons relative to a very large number of patients who potentially want this. And so the demand for surgeons to raise the level of their performance of the outcomes is significantly higher, or else you're not going to choose to have them as your surgeon, right? It's simple as that. You want somebody who's going to give you a big lift and a natural looking result. So more and more surgeons are applying the deep plane technique, even in the early stages of their practice, which is totally fine. I mean, they learn it, they adapt it and figure it out, all that stuff. But it doesn't make it easier just because you're doing it. And if you're doing it once a week or twice a month or 3 times, whatever it is, like the surgical volumes are not that high for most surgeons. This is a fact. For me, again, I'm an established surgeon. Last year I was doing 8 a week. Now I do 6 a week. I'm just toning down my practice slightly to do 6 a week, but that's a huge number. That's probably the most, in the country, I would say, somewhere in that range. I mean, you can't get much more than that. So there's a lot of experience that goes into it. However, a surgeon who has less experience is not going to have the same ability to adapt to challenges in the operating room. Simple point that I'm making. As I preface what these fillers and different things like that create for the surgeon in the operating room and why they're faced with more challenges now than ever. So here's how it goes. The surgery by itself in the most native field is more difficult. It takes more precision and intricacy of anatomy, etc. You as a patient, you can come in with two scenarios. Either you have never had any filler done in your face or any threads or any Sculptra, and then you sit on the operating table and the surgeon goes at it. That's an easier operation for the surgeon. On the flip end, you have had fillers, Sculptra, threads. The surgeon gets in there and he's faced with a much more challenging operation, and the reason for that is scar tissue. Now, we all know if somebody's had one facelift and they have a second facelift, the second facelift is more difficult for the surgeon, usually because of scar tissue. You can create that same difficult, more challenging surgical environment by using these non-surgical procedures. And that creates a more sticky, more difficult surgical space for the surgeon to work with. And if they're doing deep plane surgery, where there's literally like a millimeter difference between the fascia that covers the facial nerves and deep arteries and important muscles in the face, etc., and that's all obscured with scar tissue, that makes it a lot more challenging for the surgeon to separate that layer in a way that doesn't impose risk on those very important structures that we all want to avoid, both patients and surgeons in the operating room. How does filler create scar tissue? So keep this very, very important point in mind. A filler, the hyaluronic acid fillers, Juvederm, Restylane, etc., these are foreign bodies. This is not the hyaluronic acid that exists ubiquitously in our tissues that your body makes, and it lubricates our joints, it hydrates our skin, it has a place in almost every part of our tissue base. Hyaluronic acid that is used in fillers is cross-linked compounds. They're molecular engineered products that basically use hyaluronic acid as one of their components, but they're also composed of other components that the body does not recognize as self. And if it doesn't recognize it as self, what it wants to do is it wants to get it out of the body. It considers it a foreign body. So foreign body reaction or foreign body response is inflammatory. And the product of tissue inflammation is scar tissue. And the reason why these products have to technically be foreign body by definition is because the value of them is that they persist for 6 months to a year potentially, and then you have to redo it, etc. The reality is, if they were true hyaluronic acid, they would disappear in 24 hours. Your body has a way of recycling hyaluronic acid. In order for them to stick around, they have to be made in a way that your body can't get rid of them. The fight is on, and that fight is inflammation and scar tissue. In addition, fillers block lymphatic channels. They don't completely go away. There's been lots of studies, MRI studies, lymphatic flow studies, all these other things that show that they are blocking lymphatic channels. I mean, they literally stick around for 5-10 years and maybe never completely go away. But in addition to the actual hyaluronic acid filler that component sticks around, there's a transformation that occurs at the tissue level that creates scar tissue, and that, my friends, never goes away. So that is where, when the surgeon gets into the operating room and is separating the tissues, you start getting into this like obscure, sticky mess. Now here's the problem. For most surgeons, they don't have a ton of experience, and I don't blame them for this. They're gonna back out. If they're smart, they're not gonna go full bore, full operation, deep plane, you go from here all the way out to here in terms of the tissue dissection. They might go out to here, get into a bunch of sticky tissue, and they know the nerves and all that stuff exists down here, so they're gonna do something a little bit more limited. If they're cavalier and they're just gonna blow through it, well, then there's more risk associated with it. That's fillers. They last for a long time. They create deformity in the tissues. They block lymphatics. And here's the other thing with hyaluronic acid fillers. Post-operatively, all my patients who have these fillers in there, they swell a lot more, and there's persistent swelling around the cheeks and different areas that lasts sometimes months, if not even sometimes close to a year. So it really does hinder recovery as well, which is an unfortunate thing because everyone wants to recover as fast as possible. So the challenge is removing fillers before surgery is also very difficult, because if you put a bunch of hyaluronic acid dissolving enzyme, the hyaluronidase enzymes, what it will do oftentimes is create irregularity and waviness of the tissues, because you can't really see where all this is. I know there's ways you can use ultrasound and this and that requires tons and tons of treatments and a lot of time under an ultrasound with a needle, with a high, doing this over and over until you potentially get it all out. Even then, there's chances that the tissues aren't going to be completely smooth and even as a result of that. It's really difficult to remove all the filler, especially for people who've been doing it over a 5 or 10 year period, and it's like literally everywhere. Now, what's Sculptra? Sculptra, by definition, is a biostimulator of collagen, right? So that's how it's touted, and that's the benefit of it, right? It creates collagen, it's good. Your body loses collagen, we're adding collagen, that's what volume is, etc. It's not. Your face loses fat in the deep compartments, that areas like the temples, under eyes, above eyes, down around here, the lips. It doesn't lose collagen in the deep tissues because the deep tissues are composed of fat, not just collagen. Collagen is a big part of the skin matrix, but that's not where you're injecting the Sculptra. You're using Sculptra to stimulate the creation of collagen because that's what the molecule does, and without getting into the science of it, but the story is very simple. It's you inject this product, it stimulates the fibroblasts to make more collagen, you get this replacement of volume in the way of collagen, but what happens when you're in the operating room with those patients? Collagen and scar are the same exact thing. Scar tissue is made of collagen. So you're getting in there, again, you're peeling away the skin and doing all your normal things, and then you get into this mess of almost like concrete. It feels hard to the touch. It's like cobblestones. You're trying to get through that without getting into the wrong plane, etc. Again, it makes it much more difficult. And the more unfortunate point is you're putting volume in a space that doesn't even require volume because, like I said, you don't lose volume in those areas. You don't lose it in the cheeks, for example. You don't lose it in here. The reason why people look hollow in this is because the cheeks have fallen forward, creating a gap space here. But when this tissue goes back, you don't have volume loss there. So you don't need to put volume in an area that doesn't lose volume in the first place just because the tissues have sagged. The real answer to that is put the tissues back where it belongs. That's the foundational principle behind it. But people always try to find ways around surgery. There's all this different opinions about this, but in my strong opinion, there is no opinion about it. You put volume in areas that volume is lost, which would never interfere with surgery, and usually fat transfer is the way I do it. I don't use fillers, generally for those areas. And you lift the tissues back up. Now, Sculptra, same thing with the filler, makes it more difficult to operate for the same reasons. Threads create the same exact scenario. There could be scar tissue, there could be, past infections that are caused by it. But really at the end of the day, and I won't get into the whole biological basis of this again, but the concept is very simple. Everything that I just mentioned here, Sculptra, threads, and fillers, byproduct is scar. Scar makes surgery more difficult. The existence of volume in the way of collagen or in the way of filler makes surgery not only more difficult, but it makes creating a natural look more difficult because imagine a person who has a bunch of filler placed into their cheek over a 5 or 10 year period, right? This whole area becomes like a big ball. When you do a deep plane facelift and you move the face back up here, now you're taking this ball and you're putting it in a place that wouldn't have normally needed volume to be added, just needed the cheek to be moved up. Now what you've done is you've created a look that the person never had when they were in their 30s, which is really at the end of the day, the end game of these type of surgeries. You're trying to reestablish what 30s and 40s generally look like, But if you alter your appearance and then you have the surgery, well, you're not dealing with the same face that you were born with that just happened to age. You're dealing with a face that is aged, plus you've manipulated it. So don't expect your surgeon to create that totally natural 30, 40-year-old face that you once had. All bets are off there. And I tell my patients this all the time. They show me a picture of themselves when they're younger and then their face is full of filler. And I say, well, that ship has sailed. You don't look like that anymore. And we can't get you back to looking like this no matter what. Let's just work with what we have and make it as good as possible. In conclusion, fillers are not the enemy. You can use them in fine and very delicate ways here and there. Using them to lift your face, which is the way most people approach it, is not going to help you lift your face at all, and it'll create more challenges for you in the future. So if you're lucky enough to hear this before you started down this road, well, you're ahead of the game. If you happen to be somebody who's midway through it, well, stop doing these things, in my strong opinion. You're never gonna be able to stop your tissues from sagging. Your neck and jawline and everything else will continue to sag despite all of the fillers that you put in your face, despite all the Sculptra you put in your face, and despite how many threads you put in your face. Maybe it'll give you the illusion when you're in the early stages that it's helping because it's camouflaging, it's giving contour, etc. But that's totally different than actually stopping your tissues from sagging. So that notion of using this to stop is completely false. And I think most people know this by now. When I say most people, I think from surgeons and dermatologists. If they're not, I'm telling you, they're just not thinking straight about what they're seeing in front of them. And that's an easy thing to do when you're deep into a paradigm, a way of thinking about a problem, and you believe you have the right solution. So it's not malicious, it's just simply you could be in the wrong mental space about something and believe what you're seeing. I had the good fortune, even though I was doing these procedures, fillers, etc., for my patients, I had the good fortune of having an alternative treatment, that I could literally maintain objectivity. And when I saw my patients not headed in the right direction, or that the procedures were not effectively helping them look younger, I would tell them, hey, enough's enough. We don't need to do this anymore. Bottom line is, take all this, apply it, send this video to as many friends and family as you possibly can. Trust me, this is a much bigger and more ubiquitous problem, and help them along the way. If you haven't already subscribed to the channel, I give you lots and lots of well thought out things that are based on my own experiences, but also on science and consensus among my colleagues, etc. Then I share it with you. I do the work, share it with you, so you don't have to, worry about, whether this is coming from a trusted source or not. In addition, if you want more information like this in a different format, the CaremMD Journal is a newsletter that's totally free. So just sign up for that in the link below. Any questions you have, drop them below. Your own personal experiences with all this stuff, whether good or bad, I want to see it. And if you enjoy this content, hit like. And until next time, Dr. Amir Karim.